Hey everybody, my name is Natalie Badness. I'm an interdisciplinary studies major with a concentration in pre-physician assistant, and this is my internship presentation. So I did my internship at the community care in Rigby. There are many reasons why I chose the community care. One of those is the variety of patients that you see. It is a walk-in clinic, so you see everything from broken bones to sick kids, sliced open fingers, sprained ankles, wellness checks. You see just about everything. But they also make regular appointments, so it's good to follow up with the patients and you get to really know them. That was awesome. They do a lot of the procedures in-house, so all the EKGs, the labs, IVs, x-rays, all of that. So it was great to experience that and learn. They do a lot of referrals as well. The people is the number one reason why I chose the community care. I've worked in Rigby for a long time, and so I kind of know a few of the nurses. And the nurse practitioner that I wanted to shadow, she's a family friend. We go way back, and she works at the community care. And she's probably the number one reason why I wanted to go there. I wanted to learn from her. So it was a really comfortable environment for me. I didn't feel out of place. I didn't feel intimidated. It was a comfortable learning environment. Another reason is that community care is owned by Mountain View Hospital, and so there's a large hospital and a network of clinics that hold future opportunities for me now that I have my foot in the door. The process of obtaining my internship was really easy. I just contacted Whitney, and then from there she gave me the number, and I called the Mountain View Hospital, talked to the education department, and from there you don't have to actually apply for anything. We just had to fill out a bunch of forms and get permission and approval. So it was smooth sailing. There was a lot that I learned from this internship. It wasn't your typical internship. I didn't really necessarily have jobs that I needed to do, but I followed Whitney along with every single patient. So before we would go in the room, we would look over the chart, we would look over their chief complaints for that day, get their past medical history, and then she would ask me, what do I think? We would go over a tentative game plan for the patient. In the room, I was just observing, and then when we would come out, she would ask me what I thought, what plan we should do, what treatment. So it was really nice to be an active participant in the patient's plan. I wasn't just a bystander observing and shadowing. I really got into the thick of it and got to help with guidance kind of plan out their treatment plan, which was awesome. I worked in the medical field for 7 years, but only in dermatology. So it's kind of a learning curve to realize that there's more to the body than just skin, and there's a lot that I don't know. And every office kind of has their own language, so to speak, with the medical terminology and the abbreviations. And so that was interesting to kind of learn more abbreviations and get a refresher on some, and just kind of reading through charts and getting to know each doctor's own separate language is kind of interesting. It was really cool to learn the diagnosing and which codes to bill for and which codes you couldn't bill for, and there's a whole bunch of stipulations and stuff there. That was really eye-opening to learn as well. My overall experience was amazing. By the end of my internship, I felt like I had really learned a lot. I was starting to know what treatment that Whitney would pick for each patient. I was, without looking things up, I was learning a lot. It's good to learn from a doctor's perspective because I've always just been the CMA, the nurse that helps, and it was really nice to help make the decisions and not just follow the orders. And that is something that I cannot wait to be able to do, is just to make the decisions. And each patient kind of presents a puzzle, it's a mystery, and I learned a lot about which questions you need to ask and which tests you need to order in order to solve the problems. It was really a fantastic opportunity for me. My future plans is I'm going to apply to PA school in April, so wish me luck. Here I go. And that's kind of my only goal. There's no other plan B, there's no other options. I am going to be a PA. Advice for future interns would be you are an intern for a reason. People don't expect you to know everything, so don't let any insecurities hold you back. Go into any opportunity that you have with open mind, and just be willing to put forth a lot of effort into doing whatever they ask you to do. There's good opportunities to gain connections and networking with others for future opportunities. Never close that door, and always leave a good taste in people's mouth afterwards. And be grateful for the opportunity. Let people know that you appreciate their help and their assistance and guidance in learning. And that is pretty much it. Thanks for watching.